Hi, and welcome back to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know about some of the most common health conditions listed from A to Z, and today's topic starts with the letter I. So let's talk about insomnia. What is it? Insomnia is a sleep disorder in which you have trouble falling asleep or staying asleep. This condition can be short-term or acute, meaning you only have it one night to maybe a few weeks, or it can become long-term or chronic, meaning you have it at least 3 times a week for over 3 months. There are 2 types of insomnia. The first is primary insomnia, meaning it is not linked to any other health condition. And the second is secondary insomnia, meaning it is linked to another health condition that you may have, including asthma, depression, arthritis, cancer, heartburn, or chronic pain. Also, substance abuse with either medications, drugs, or alcohol can also lead to insomnia. What is the cause? Like we talked about, the cause of secondary insomnia is going to be due to any of those underlying health conditions that you may have. In contrast, for primary insomnia, one of the major causes can be stress. If you have recently undergone a major life-changing situation, that can lead to a lot of stress, including the loss of a job, loss or death of a loved one, moving, or even a divorce. These may be things that you tend to worry about and can keep you up at night. Other causes for primary insomnia may include a change in your sleeping schedule, for instance, if you had a new shift at work, or perhaps you just came back from a trip overseas and you are experiencing a lot of jet lag. And lastly, things like light, temperature, or noise can affect your sleep. What are the symptoms? The symptoms of insomnia may be fairly obvious. If you don't get a good night's sleep, you can imagine the next day you can be very sleepy. You could experience ongoing fatigue, grumpiness, or loss of concentration during the day. Diagnosis. To rule out any types of secondary insomnia, your doctor may ask you if you have any history of mental health disorders, including depression or anxiety. They are going to ask you if you are on any medications, for instance, if you are taking a medication for a cold, allergies, depression, high blood pressure, or asthma, as some of these medications can keep you up at night. There are a few other conditions that lead to secondary insomnia, including restless leg syndrome, sleep apnea, or hyperthyroidism. Your doctor is also going to ask you about your sleep habits and if you have an excessive amount of caffeine or alcohol use. If your insomnia is ongoing over the period of several weeks, your doctor may ask you to take a sleep diary, which can keep track of how much you sleep during the night and how you feel during the day. What is the treatment? Typically, for acute insomnia that only lasts maybe one night to up to a few weeks, doesn't require any treatment. If the insomnia was due to a stressful situation in your life that is now resolved, typically the insomnia will also resolve. As doctors, we like to educate our patients about good sleep hygiene. This includes having a set time that you will go to sleep every night, and you will want to avoid any activities that stimulate your brain or would keep you up before you fall asleep. These can include activities like drinking caffeine before you fall asleep, exercising before bedtime, watching TV, or looking at your phone. Excessive screen time before bed can expose you to more blue light, which has the ability to keep you up at night. For insomnia related to anxiety, you may want to practice relaxation techniques or meditative practices before bedtime. And if none of these behavioral treatments are working for you, the next step would be to take an over-the-counter sleep medication. The most common over-the-counter treatments include a supplement called melatonin and a common allergy medication known as Benadryl, because one of its side effects is drowsiness. For insomnia that is not well treated with over-the-counter medications, or for insomnia that is becoming chronic, you can discuss with your doctor about starting a sleep medication that is prescribed. However, these medications can become habit-forming and can be addictive, so you would want to avoid them if at all possible. Complications. Sleep is very important for both our bodies and our brains, and if you're not getting enough of it, you can experience certain complications. A lack of sleep over time can definitely put you at more risk for depression, anxiety, as well as things like high blood pressure and obesity. It can also affect your learning and memory and cause problems with your concentration, which can overall affect your performance at school or work. And lastly, how many of you know that if you don't get your sleep, you're just an overall grumpier person? So let's talk about prevention. There are actually quite a few tips that you can use to help avoid insomnia in the future, and these include going to sleep at the same time each night and waking up at the same time each morning. This can get your body into a regular sleep pattern and routine, and you want to make sure not to take naps throughout the day because that can also keep you up at night. Certain food products can affect your sleep, so you don't want to be having a large meal before bed, and you don't want to be having any type of caffeine or caffeinated products right before bed. Keeping your body overall healthy with exercise throughout the day can help you sleep at night, but don't exercise at least 3 to 4 hours before bedtime. Like we talked about, you don't want to be looking at any TV, phones, or ebooks right before bed because the light can keep you up. And lastly, you want to make your bedroom a comfortable place to sleep, and that would include having the proper lighting, making it dark, having no noise that would keep you up, and having the right temperature so that you're not too hot or too cold. If there are certain sounds or light that is bothering you that you can't control, you can use earplugs or eye covers to help you sleep. Some people even benefit from using a white noise in the background. Others like reading a book or taking a bath right before they go to bed. Overall, you want to experiment with the best nighttime routine for you that will help you sleep. And that wraps up our discussion on insomnia. I hope that some of these tips were helpful for you to avoid insomnia in the future. If you have any further questions, please let me know in the comments section. I would be happy to answer those for you. If you would like to see more educational videos like these, be sure to subscribe as I am posting new videos every Friday, and I will see you on the next video. Until next time, bye!